Hi guys, so today we will see about the next topic, that is the Pap smear. Okay, so regarding the Pap smear, there are other names also for the Pap smear, that is, you call it as Papani-Kolov test or exfoliative cytology. Okay, so cytology is nothing but it is a Greek word. அப்படினா என்னன்னா cell-ஓட study. So study of cells you call it as cytology. So actually all sexually active women older than 21 years should undergo an annual checkup with a 3-yearly Pap test. A yearly negative Pap smear for 3 years is assuring then thereafter a 5-year test is adequate. 3 years continuously if they receive the negative Pap smear, then therefore we can follow a 5-year test, that is adequate. Now what are the indications of Pap smear? First of all, so Pap smear is a screening test, just a screening test for the diagnosis of your pre-malignant and malignant lesions of the cervix. Okay, and also to determine the estrogen activity related to menopause or endocrine abnormalities. So estrogen activity determine pannavum we need the Pap smear. So these are the two indications. Now what is the prerequisite? Pap smear பண்ணனும்னா what is the prerequisite அப்படினா patient should not have intercourse or touch for 24 hours before the Pap test. So the best time to do Pap smear is at around ovulation. Ovulation we know it is 12 to 14 days. So around ovulation you can do, but any other time can also be done. Okay, so this is the prerequisite. Now coming to the procedure. So for the procedure you need some instruments, right? So the patient is placed in the dorsal position with the labia parted. The cervix is visualized after placing Cusco's bivalve speculum. As you can see here, this is the Cusco's bivalve speculum. Now the cervix is visualized with the help of this instrument, and the ectocervix is scraped using an Ayer's spatula, as you can see here. This is Ayer's spatula, and this is regarding ectocervix. Now regarding endocervix, you will scrape using your cyto brush, that is the you can see image associated with Ayer's spatula, that is cyto brush, which is used to scrape your endocervix. Now the cells which are received, they are smeared on a glass slide and fixed in a 1:1 mixture of 95% ethanol and ether, kept in a jar. Okay, so they are stained using the Papini-Kolov stain and examined. Okay, so this is regarding the procedure. Regarding the interpretation, when you say it is a normal interpretation abdinaka, normal smear you can say only when there are 3 types of cells, that is the basal and parabasal cells, that will be usually small, rounded and basophilic with a large nuclei, that is basal and parabasal cells. Now the cells from the middle layer, they will contain squamous cells, transparent and basophilic with the vesicular nuclei. Now regarding the cells from the superficial layer, it will be acidophilic with a characteristic pycnotic nuclei. What do you mean by pycnotic? Pycnosis na enna nucleus shrinkage ஆயிரும், right? So basal cells வந்து basophilic இருக்கும், cells from the superficial layer acidophilic இருக்கும், நடுவுல உள்ள layer middle layerல இருந்து வரக்கூடிய cells squamous cells இருக்கும், which is also basophilic. Okay, so இது மட்டும் தான் இருக்குமா அப்படினா, in addition in normal smear you can see endometrial cells, histiocytes, blood cells as well as bacteria can also be seen in a normal smear. Okay, now இப்போ வந்து abnormalக்கு என்னென்ன பண்ணலாம் அப்படினா, in abnormal you will see actually the Papini-Kolov system. Okay, so Papini-Kolov system, it is a Pap smear of cervical cytology where graded for up to grade 1 to 5. Okay, so class 1 to 5 grade பண்ணிருந்தாங்க. So regarding the Pap smear, you grade into 1, 2, 3, 4 and 5. The first grade is actually a normal cytology, as you can see in the pic. The second grade is inflammatory smear, and the third grade is mild dysplasia, and cervical intraepithelial neoplasia grade 1, as well as according to Bethida's classification you can call it as LSIL. LSIL na enna appadina low grade squamous intraepithelial lesion. As you can see, the Pap Smear class 4 is moderate dysplasia, CIN grade 2, HSIL, that is a high squamous intraepithelial, high grade squamous intraepithelial lesion. Okay, so fifth Pap Smear class is dysplasia of severe dysplasia, CIN grade 3, and Bethida's classification HSIL. This is regarding Pepinoculous system. Now coming to the new system, that is Bethida's system of reporting. That includes abnormal results such as your squamous cell abnormalities and glandular cell abnormalities. Squamous cell enga pathona middle layer, right? So squamous cell abnormalities பொறுத்தவரையும் atypical squamous cells இருக்கலாம். Atypical squamous cells of undetermined significance, that is ASC US இருக்கலாம். Atypical squamous cells cannot exclude HSIL அப்படின்னா ASCH, that corresponds to PAP class 2, and your LSIL, low grade squamous intraepithelial lesion, PAP class 3. High grade squamous intraepithelial lesion corresponds to PAP class 4, and at last your carcinoma, squamous cell carcinoma, corresponds to PAP class 5. Now coming to the glandular cell abnormalities, you can say atypical glandular cells not otherwise specified, NOS சொல்லலாம். Atypical glandular cells favoring neoplasia, FN சொல்லலாம். Endocervical adenocarcinoma சொல்லலாம், in situ, okay, and endocervical adenocarcinoma. So these are all the abnormalities and grading. இப்போ எப்போ false positive result வரலாம் அப்படின்னா, any infection இருந்தது அப்படின்னா then you can get a false positive result. False negative when will you receive அப்படின்னா, usually the Pap smear should be obtained before vaginal examination. Vaginal examination பண்ணுறதுக்கு முன்னாடியே Pap smear பண்ணணும். ஏன் அப்படின்னா, during vaginal examination if you should use your fingers, they may remove your desquamated cervical cells and give a false negative report. Okay va, so அந்த cells remove பண்ணிடுச்சுனா you will get a false negative report. So the lubricant may prevent, by the use of lubricant it prevents the detection of organisms, and any vaginal bleeding during examination may preclude a proper visualization of the cervix. So you can visualize the cervix proper. Okay, so this is about the procedure and interpretation. Now at last coming to the contraindications of the Pap smear. So two contraindications. One is in a postmenopausal woman. You can say not absolute contraindication, we can say it is as relative contraindication. Why? Because in postmenopausal women, if the squamocolumnar junction is indrawn, squamocolumnar junction indraw agum அப்படின்னா due to the estrogen deficiency. So if it is indrawn அப்படின்னாக்க we can give a 10-day course of estrogen cream. If we give this cream, there will be exposure of the squamocolumnar junction better and yields an accurate result. This is one contraindication, and the other contraindication is post-radiation. Post-radiation cytology is difficult to sample. Why? Because there will be scarring and atrophy of your vagina. So the cells are often enlarged, vacuolated with multiple nucleation and nuclear wrinkling. So எல்லாமே atrophy ஆயிரும், vagina atrophy ஆயிரும், cells எல்லாமே ரொம்ப பெருசா இருக்கும், nucleus பெருசா இருக்கும். Okay, so inflammatory cellsம் இருக்கும். So post radiation cytologyங்கிறது difficult. So this is a contraindication of Pap smear. That's all guys, this is about Pap smear.